So this 55-year-old lady from Iraq has been diagnosed to have Parkinson's disease since 8 years. She's been on medications intermittently, but her major issues with disease as well as in medications is that she would not tolerate any medications, both the regular levodopa dose. She would have a lot of GI disturbances. She had symptoms like giddiness, belching, nausea, vomiting, and she would take for a couple of weeks and then she would give up. So this went on for last couple of years. She's visited a couple of, multiple neurologists at her own country, and also she has visited even places in Europe and probably Southeast Asia. Various combinations have been tried, but she continued to have this type of side effects with the medications and she would not tolerate it. She approached us this year, 6 months back, with this type of resistant things, and meanwhile her disease also had progressed. She had become very slow in her walking. Her body movements overall had become very slow. She had tremors in both her right hand and left hand. So she had become dependent on most of her day-to-day activities on her family members, and she would feel very depressed about the same. Otherwise, her cognition, her memory has been quite good. She would understand everything, comprehend everything, but because of her motor symptoms, she would depend on others for her day-to-day activities, and because of this, she would not go out, socialize and all. So we did bilateral STN DBS 5 months back in our center here. She required a little bit complex programming because of both tremors and gait issues, but in 2 weeks time post-op, we could establish a good programming parameters for her, and her tremors almost improved completely. Her gait had improved. She would walk independently without much swaying now, and then it was very comfortable post-op 2 weeks later. And the family members were also very keen to be part of the programming, and we taught them about various settings because they don't stay here and they can't come for follow-ups regularly. We made them part of the programming, and we gave them different grouping, which we are now doing for a lot of our patients, where they can adjust the settings in the DBS programming and now give the best outcome, best symptom relief, be it tremors, be it gait, be it slowness or stiffness. So overall, now we get regular feedback from her son in Iraq. She's really doing well and she's quite happy in terms of the outcome overall.